I want to welcome Dr. Anson Service to Bourbon with Beagle, a talk on the rocks. And today we're going to talk about autism, specifically across generations, but older individuals. And I always ask two questions, Anson. What generation are you in? Oh, great, great generation. And the other question I've been asking folks is, what is your personal philosophy of aging?
Good question. The funny thing is the older I get, the less philosophy I have on aging. I'm beginning to understand that. Uh, oh man, so many factors go into this. I don't think I have one anymore. I really don't. I mean, so many factors as far as health and environment and like you name it, and it's going to affect something and how I feel about it. So, yeah, I guess my answer is none.
Nah. So it's kind of like we talked a little bit about this, and it's a spectrum from that, depending on different factors that we have coming into the aging process. So, with autism specifically, how does that kind of affect an individual through the process? We have younger, middle-aged individuals, and then older. How does that affect? How does autism affect each one of those generations?
we, the first case of autism wasn't even really identified until the 1940s, and it was based on children, basically young boys. And at this point, right now, when we fast forward to current year, we're now finding autism exists in older individuals as well, which we already knew, obviously, but it's just a completely different animal than when they're young children. So young children might have certain behaviors and features and traits that you would consider abnormal, and yes, that continues on through the lifespan, but at the same time, it looks very different. So depending
And
on what age you are and developmental level, even the developmental level is probably more appropriate rather than age, because some people develop at a much different rate than other people within the
right.
autism.
And so, what do you mean by abnormal behavior? What does that look like?
Well, if you were to get a basic definition of an autism, it's essentially, um, you're right, it's a spectrum. There are a lot of traits and features that usually become more apparent and identifiable when it's in early childhood. So some things that an earlier not necessarily infant, but a child might exhibit is failing to attach to the parents in a way that would be typically expected, not having eye contact, and I want to really stress the idea that this is not every single kid with autism either.
Sure.
It's some of them have this, and these are the core features that they've identified in that being having challenges and imaginative play with other children, um, being having a lot of sensory issues, everything from seams in the socks to tags in the shirts, and some of these can continue on through every phase of life, every age, but some of them can be kind of go away or become decreased as they get older, but some actually even get worse, and different features might pop up later in life. Like, for instance, a younger child may be socially excited, like really excited to be in social situations. And then by the time they hit high school, they may shy away from social situations. And then by the time they're adulthood, it creates so much anxiety to be in a social situation that they may have anxiety disorder because of that type of thing. So it really spectrum is the magic word here. It's really a wide spectrum, very deep, a multi-dimensional spectrum. I know a lot of people want to think of it as like mild to severe, and it's not like that. It's a universe of
Right.
different features and traits that come and go. So, yeah.
So, a lot of times, I know individuals that have been tested and diagnosed like in their 40s and 50s. Uh, how do you establish that they are probably on the autism spectrum? Do you do that by testing or how does that determine?
Yeah, that's a good question. We're like I said earlier, we're in a very interesting time right now. This is basically the birth of adult autism diagnosis right now. And yes, it could be diagnosed earlier on, but I don't know what the percentage of clinicians that actually, number one, know autism well enough to diagnose it in anybody, but then again, one step further, know it enough to diagnose it in adults is almost zero, like percentage wise. It's
Right.
very, very small. So essentially what we get is we get people who have lived their entire lives. This is what we're seeing in our clinic anyway. People who've lived their entire lives, and they may have been diagnosed with borderline personality disorder or bipolar disorder, depression, anxiety, schizophrenia. I mean, you can go down a whole list of different diagnoses. And then and it's not to say those are wrong, by the way, but
Right.
oftentimes when they come in, they're kind of at their wits' end, and they're like, I don't know what's going on. I keep getting all these different diagnoses. I've been inpatient, maybe not inpatient, but like I don't know what's going on, need some answers. So when we end up doing testing and we find out, oh, guess what, autism spectrum disorder, it answers a lot of questions.
Sure.
So right now, the interesting part is social media has brought this to everybody's, or a lot more people's awareness, I should
Right.
say. So we've got apps like Facebook and Instagram and TikTok, and on those platforms, people are starting to uh, gravitate toward other like-minded individuals, people who have a similar brain pattern functioning, and they're starting to find out, oh, that's what I do too. Oh, you do that, I do that too. And once these little evidences start to stack up, then they start to identify like more closely to the idea of being autistic than not. And so that's when they oftentimes will come in for clarification
Hmm.
on that. A lot of people coming in, they already have an idea. Some have even been self-diagnosed for quite a while, and they're just coming in for clarification to end imposter syndrome, to
Right.
to to basically get some validation for their concerns. And so that makes it a lot easier when they've got a better idea of what's going on before they get here. But
And I have two questions regarding that. One is when you work with, say, somebody that is aging 60, 65, and on up, and they've never been treated for this autism type of spectrum, how does it, would it benefit to have that testing done to determine whether some of the behaviors, some of the issues that we have in them going into later life would be based on autism, not necessarily these other diagnoses?
oh, absolutely. Yeah, being able to clarify, like, oh, I don't have borderline personality disorder. What I have is undiagnosed autism, and somebody's missed it their whole life. So testing is interesting because there are we do about anywhere between 5 and 12 different tests
Hmm.
on people when they come in for an assessment, and we want to make sure that, number one, we're hearing them correctly on everything they're saying. So we come at it from every angle that we possibly
Right.
can. And not only that, but these tests are typically normed on a massive population of people. So uh, so when we're doing testing, it's not Dr. Service saying, hey, I want you to have this diagnosis. It's not like that. It's the data, and we
Right.
say, hey, based on the data on however many millions of people who've also taken this test, you score at the 98th percentile for autism spectrum disorder.
Right.
And again, that's just one test, and when we combine that with another 6 or 7 that all kind of say the same thing, then it kind of takes a lot of the guesswork out of it.
Right.
One of the main benefits is that people have made, the human mind really wants to make sense of itself. It wants to know where it exists in this world. And when you grow up autistic, but you don't know you're autistic, we tend to have other people tell us who we are and what we are.
Hmm.
We tend to tell ourselves what we are based on outside information. So people may come in and say, I think I just grew up really stupid, or, oh, I'm just a B word, or I'm just like, I just need to have my space all the time. Here's a good one when people say, I'm sorry, I just need to say what I think and I don't care what anybody else thinks.
Hmm.
There's all these things, they take on these different identities. And really, um, when we bring this diagnosis to light, suddenly it's, I can't tell you how many people sit across from us in tears as all the pieces start to fall into
Sure.
place in their life. It just answers a lot of
Right.
questions.
Now, is the testing the same across the spectrum from ages of children to middle age to older adults? Is it the same type of testing?
Oh, that's a great question. Absolutely not. In fact, Gary, I'm so glad you asked this because, oh, this is such a frustrating thing for me. Um, I said earlier there aren't that many clinicians that test
Right.
for autism in adults, and so one of the things that we've been seeing, I'm on some online groups, by the way, with people throughout the world who do autism testing on adults. So we get to get together and commiserate and identify trends and things that we're seeing throughout the entire world. But one of the things that's been happening is people will go in for an autism diagnosis, and number one, they'll either be immediately uh, basically shoved off and say, oh, you can't be autistic because you drove here today, or you can't be autistic because you made it through school, or you can't be autistic because you made eye contact with me during our conversation. They come up with all these things, and a lot of not only medical professionals but mental health professionals have these outdated ideas about autism that aren't true. So here's one of the big problems is they'll say, okay, we'll do some testing, and then they'll pull out testing that's intended for 4-year-olds or 12-year-olds, and then they'll do this on somebody who might be the principal of high school
Hmm.
who's in for testing. And I'll tell you right now, that's not an appropriate
Sure.
measure to use for somebody like sitting across from somebody and reading a children's book with them to identify nonverbal and communicative deficits is not going to work with somebody who is
Hmm.
again, like CEO of a corporation or running their own coffee stand.
Right.
And those things just don't work. So they've been traditionally getting a lot of false
Right.
negatives because using the basically inappropriate measures on autistic adults. And then I want to go one step further. People who identify as female, that's a whole other subgroup right then and there that are being not identified as well, because again, some people just think they're bitches or something, and they're not. They're great people who are just misunderstood, and it doesn't look like a 12-year-old boy from the suburbs.
Right.
So there's huge issues. So yeah, a lot of the testing is very different from throughout the ages. Now, I will say this one more. I'll add this, that depending on their developmental level, some of those tests might be appropriate for different age groups. So I've tested some people in their 20s who maybe during cognitive testing, meaning like IQ testing, they test a little on the lower side. And in cases like that, sometimes it's okay to use some of those other tests. But there are tests specifically developed for adults that are
Right.
more sensitive to.
So there is a misconception, I understand from you, that high functioning, such as CEOs and things like that, have autism, but they've dealt with it in as they've gone through their life, and so they've kind of adapted. Is that a fair statement?
Oh man, you are smart. You're onto this. No, what? Yeah, that's exactly what's going on. It's more like what you said. They've dealt with it. They've worked out a lot of workarounds. So, for instance, a child who's in the fifth grade, let's say, just as an example, a young boy who's on the playground in the fifth grade, who gets beat up several times because he keeps saying things that are inappropriate. Some of them will learn really quick what they can and can't
Sure.
say. They'll watch other people like a hawk. They will adopt other people's phrases. They'll adopt the way they behave and act. And they'll say, okay, that kid did not get beat up, so I'm going to emulate what he's doing. Again, a lot of this is maybe
Yeah.
unconscious, but they're just watching carefully, pulling in behaviors, and then emulating those in a lot of different ways. So a lot of workarounds as far as social things go. If somebody really has a hard time with social situations. It may take them 2 or 3 days to
Mhm.
recover, but while they're out in the social situation, they may be the life of the
Right.
party. They may have the greatest jokes. They may have all. I remember one fella that I tested. He learned how to be hilarious, and the way he learned how to do this is by carefully analyzing groups of people, and he actually made algorithms in his mind about certain phrases, how to say them, when to say them, and he would test them out on groups, and eventually he became hilarious,
Yeah.
and he was hilarious. but but I mean, that's just kind of, there's a lot of workarounds that people come up with, and the biggest problem here with the workarounds though is we call that masking
Hmm.
in autism. And the longer you mask, and the more benefit you get from masking, the more difficult it is to drop that mask when when you can feel like you can become more
Sure.
yourself. So a lot of these adults, like what you were asking about, in their 50s, 40s, 60s, they've masked their entire life, not because they wanted to fit in, but because they had to for survival
Right.
reasons. And they're not about to drop those masks now because it's worked well for them to a certain
Right.
degree, right?
And
But yeah, a lot of pressure there to just be
exactly.
normal.
And they become very successful. So I think a
Absolutely.
lot of times we think if you have autism, you don't have the skills necessary to be successful. And that's not true. So I think they have been. What about older individuals that start losing their cognitive abilities and have an all autism diagnosis? How does that play out?
Do you say if they do have an autism
Diagnosis
diagnosis?
and their cognitive deficits are now appearing as they age through the process.
Yeah, you've probably uh, shined a light on one of the greatest research holes in autism right now. Is research based on older individuals, especially those that are reaching the sunset of their lives, the ones who they just don't get
Yeah,
tested. I mean, excuse me, there's not a lot of research on
sure.
that right now. So we're still trying to figure out what that looks like for a lot of individuals, especially ones who've been
Right.
misdiagnosed. Some of them are living in care homes. Some are living independently. I brought up the very first person who was diagnosed, and he was diagnosed in the 1940s. And interestingly enough, he's still alive today, and he apparently is living in Mississippi and is living a really full life, driving golf cart around
Yeah.
and working and doing all the other things. Or, he was. I think he's approaching 90 years old now.
Well,
But anyway, he's figured out
yeah.
life and how to live it on his terms. Then you have people like Sir Anthony
Hmm.
Hopkins. He's been diagnosed as autistic, but he obviously he's figured out his life to
Sure.
some degree. At least that's how it appears on the
Yeah.
outside, and that's actually a really good example of masking as well. He's so good at masking that he can take on whatever role he wants
And do well with it.
and give a star-studded performance.
Exactly. Well, I think a lot of things that I see is the masking drops away as the cognitive deficits come up. So some of the maybe behaviors we're seeing, we're thinking is something else entirely, but it's really been there all the time, and we just need to treat it now with a different approach.
Yeah, I would agree with that. I think the normal aging process already suggests that that's a real thing. I mean, everybody to some degree will
Right.
mask throughout their life for the most part, but as you know, and you work with quite a few individuals that would be like this. As they get older, some of their cognitive faculties decline to the point where they're no longer able to
Right.
keep up the charade any
Exactly.
longer. The difficult part there is what we do with those individuals. Do we respect them and their history and their wisdom, and or do we just kind of shuffle them off to a home somewhere and to be forgotten? And that's why it's so important to have people such as yourself who actually care care about these people and can help take care of them to some
Well,
degree.
unfortunately, we shuffle them off, and that's one of the discussions we've had in the past with some of our, especially generational groups, is how do we change this image of doing adult family homes, skilled nursing homes, assisted living, when other parts of the world does not do it that way. So that's a discussion for another time, but absolutely.
Sure.
Um, I'm really kind of interested in urban versus rural and the lack of services in those areas, and especially in the world. I mean, take India, for example. Uh,
Sure.
they don't have the same type of benefit we do in the US with even probably the testing. So I know you do some in rural areas, testing there versus urban. Is there a difference or lack of services?
Oh man, the lack of services is it's so pronounced. I've actually tried. I've attempted twice now. I've got one practice that does well here in Vancouver, but I've attempted two other practices in rural areas, and both of them has failed. And it wasn't because of a lack of need. In fact, there was so much need. It was an overwhelming amount of need out there. The resources were actually there in terms of like insurance
Right.
coverage as well. What I had a problem with was finding qualified professionals. That's what I
Yeah.
had a problem with. People who, number one, wanted to move or at least,
Hmm.
travel to an urban or a rural area to do just even
Hmm.
just therapy. I found it I found it so difficult to find people to do that. Not only that, but how to pay them enough to make that worth
Sure.
their time, I guess, has been the issue either. So my hat goes off to those people who serve in the rural communities. Because apparently, I don't really like the city very much, but apparently a lot of people like to be in a in an
Yeah,
urban
exactly.
environment. I would rather be in a
Right.
rural
Right.
environment, but
And
you know,
unfortunately, it's state by state. I have a cousin that's autistic in Oklahoma, and there's extremely lack of services. Where up here we have a little bit more. So I think the states are also playing into the picture of lack of services just because of cuts to budget and their whole their whole idea of we don't provide these services because other people should, and we just don't want to be involved in that diagnosis.
yeah. And to go a step further, I receive several messages a day from people throughout the country or the world, and I'll get them every once in a while. That will be people from other countries that are lamenting the fact that they can't get tested in
Sure.
another country. One of my friends, he just told me that he is on a 6 year wait list for this. Well, he told everybody, he said it online, but a 6 year wait list for autism testing, and that's in Canada. So that's
Yeah.
just our neighbor. And if you're on a 6 year waiting list to get an autism assessment, I think
Yeah.
that's ridiculous. And then we have other countries who they won't even look at testing adults at all, period, because adults don't have autism. That's
Right.
kind of the idea out there. So it's not even a thing in some countries, or at least in some areas of some countries. Now I do recognize there probably are people who are very proficient and up to date in these
Right.
things in other countries, but I would sure love to get with them and work out an alliance of sorts, see if we can get this information out to more clinicians because I
And
think that's the
why do
key.
you think there's a lack of research? I mean, large institutions, hospitals should want to do some type of research on this, and it appears that they're not in older adults. Why do you think there's a lack of that?
I think the first problem is that it's not
Okay.
recognized yet amongst most medical professionals, and I mean they'll recognize it, but they'll do it in the form of
Hmm.
Rain Man, or in the form of the good doctor. That's the idea of what ought, or the person who's completely dependent on support
Right.
for other people. Who lives with parents or lives in a group home of some sort. So that's kind of the idea about autism. I had an experience not too long ago where I accompanied somebody to the emergency room. And this was during COVID. And the reason I accompanied them because I am a huge advocate of um, having a medical advocate with you when you go to the doctor if you
Right.
are on the autism spectrum. And the reason for that is because sometimes there can be communicative differences and you might not convey what you need to convey. Thus, you won't get the treatment you need to get. And, it just
Right.
prolongs the whole problem. So, anyway, went into this emergency room and the gatekeeper at the door stopped us and said, only this person can go in. I said, well, I can, I'm the caretaker. So they said, and they looked at both of us and like, okay, whatever, and put us on through. And then we went and waited in the waiting room. And when the nurse came out, she called this person's name, and we both got up. And the nurse said, "Oh, I'm sorry, only this person can come because of COVID guidelines." I said, "I am the medical advocate, and this person is diagnosed autistic, and I'm there to advocate." And so the nurse, it was the strangest thing. I felt like time slowed down, but she looked this person up and down from head to toe and said, "Just a minute," and left for 5 minutes and came back out and said, "Yeah, I don't have any record that you're autistic, so you're going to have to, just come in alone." And that happened not once, but on two different occasions in the
Really?
last year, just with me as an advocate. And that's just me, and I don't even do this hardly ever. So this is probably our biggest problem with research, is that there is this idea about what autism is
Right.
and isn't, and I want to say it's woefully behind, and it
Yeah.
really needs to catch up in the medical
Well, I think that
community.
Brent has another question for me, which is, we know what a person on the lower end of the spectrum looks like. Does a higher end spectrum individual look like?
Oh, yeah, great question. So the DSM in
And
2013
DSM
changed.
is what?
Yeah. Oh, sorry. Yeah, it's the Diagnostic and Statistical Manual. It's through the American Psychological
And this
Association.
is your
Basically,
Bible.
it's the book we use with
Yeah.
all the
Yeah.
disorders in
Okay.
it. Yeah. So when we go to diagnose somebody, we look up in that book what the criteria are to
Hmm.
meet diagnosis. And just this morning, had to go through and bit by bit, line by line, go through and make sure this person met or didn't meet criteria for autism spectrum disorder.
Is that because of insurance billing? Is that how they make that?
No, it's mainly just to
Okay.
guide clinicians. Yeah, the insurance codes are
Okay.
a whole different thing. We've got another two bigger books that have
Okay.
insurance code information. Oh, that's a whole other discussion too, Gary. We need to talk about
Absolutely.
that. But the 2013 they changed it to be levels of autism. So we have level 1, 2, and 3. Level 3 means it's a person with the
Hmm.
greatest need of support. Oftentimes, that looks like somebody who is completely dependent on other people financially, oftentimes physically. Maybe hygiene
Hmm.
isn't being tended to on their own. Um, and that would be, appropriate for a group home,
Sure.
living in the parent's home, or loved one or family. So that's what a level 3 looks like. Level 2 is somewhere in the middle, where you've got somebody that needs help, but can still possibly live on their own and hold a job, but we're having frequent meltdowns and just
Hmm.
problems, generally speaking, a lot of sensory issues that are very apparent. So basically, you need somebody to help them out. Like me going with
Hmm.
somebody to their doctor appointment. That's a great example of being with somebody who might be
Okay.
level 2 autism. Um, and then we have level 1, who have the lowest amount of support needs. But here's the issue: is that's just what we see on the outside. So if we say, "Oh, you're a level 1 autistic individual, you have the lowest amount of support needs," they might say, "No, that can't be. You have no idea what kind of support I need. I look like I hold it together on the outside as the manager of a restaurant or whatever, or a waiter or something like that, but like
Hmm.
inside I'm dying. As soon as I get
Hmm.
home, I melt down. It take hours to
Sure.
recover from this." And it's everything I've got just to pay a bill or to make a phone call. I can't make phone calls. So yeah, it's not perfect. That's for sure. So the high excuse me, the high and low functioning labels, those have kind of gone away for the most part, but I think they're used because of ease, and
Sure.
it's easy to understand them a lot. But level 1, 2, and 3 with support needs is the official
And so Sir
reference
Anthony
to that.
Hopkins would probably be a one, I would say. Possibly be a
Yeah,
one.
possibly. I would. Yeah, that would be interesting to see how he
Yeah.
is.
Yeah.
Offset, off
The
camera.
the the other question is, does the testing give you enough information and data to put them in one to three?
Oh yeah, absolutely. Some of the tests that we run are called adaptive functioning tests, and adaptive tests are basically designed to identify limitations and strengths, like in daily life, like how you are, you know, getting up and doing things and
Hmm.
interacting and just basically can you live life on your own
Sure.
or not, or what kind of difficulties and challenges you have. So yeah, that's part of the testing process as well.
Well, good. And so we've talked about testing. Let's talk a little bit about treatment. What are some treatments for
Oh yeah.
these individuals that um, is out there?
The Probably the number one treatment that is known about that people engage in is something called applied behavioral analysis, or ABA, and this is probably one of the most controversial treatments in existence
And
right
and
now.
and
um,
what does it
and
stand
usually it's
for?
only
What does it stand for? The
up, yeah, it stands for applied
analysis.
behavioral
Okay, and you said
analysis,
that earlier. Evidently, I wasn't
ABA.
listening. So ABA
Oh, that's okay.
on that one.
uh, the reason it's so controversial is because essentially the idea is to take a set of behaviors and then apply some sort of system. Often it's behaviorally based system, reward, consequences, and then in an effort to change behavior, to
Okay.
change the outcome of what's going on. So this in the history of this treatment, it's got a rather sordid history, actually. Again, back from the World War II era, um, and a lot of autistic individuals who've been through it consider it to be cruel. They consider it to be a
Hmm.
punishment based system. They believe that it's designed to help them figure out how to look normal. And of course, the translation to that is, oh, so we don't make everybody else uncomfortable with who we
Sure.
are as individuals. That's kind of the idea behind it. Now, on the flip side of that, I've heard many parents speak praises about ABA. And it's a very intensive therapy, by the way. It's the most popular, it's probably most often the only therapy available to autistic individuals at a young age, anyway. But a lot of parents like it because they say, "Oh, my child was doing nothing but biting himself and throwing things in the house and screaming constantly, or at least many times throughout the day." And then when I took him to ABA therapy, that helped him to maybe gain control of his behaviors and thought patterns a lot better. So, and whether that's true or not, I don't know. That seems to be what they're experiencing. We also have to consider that there's
Sure.
development that's occurring as well. So if somebody is in ABA for 4 years and they go from being one style of behavior to another from the ages of 3 to 7, you're going to see changes in behavior anyway, even without
And is
ABA
there any
therapy.
studies or
Um,
data on how successful this is?
Yeah, well, the studies are interesting because a lot of them come from a lot of the results come from the parents and
Okay.
from the clinicians. So they're identifying certain behaviors and they're saying, "Oh, we were able to decrease, self-injurious behavior by 80% over the course of the year." And that's good by most people's standards. But again, once these children are out of ABA therapy
Right.
and they get into adulthood, if you want to get on Google and type and have an interesting read, type in autistic adults what they
Mm.
think of ABA therapy, and you'll get an eyeful. It's quite they have a lot to say about it. Again, most of them considering it abusive and
Sure.
a terrible practice. So now on the flip side, there are opportunities for other types of therapeutic interventions to be carried out
Right.
in the course of ABA therapy, or at least what they say is ABA. So rather than using, say, shock collars or something along
Oh my
that, which has
God.
been done in the past for bad behavior, um, rather than using that, a lot of ABA places, I think they just actually stopped using shock
Thank
collars like
God.
several years ago. And when I say several, I mean like
Really?
maybe 3 or 4 years ago. From what I remember, yeah, it was not too long ago that they stopped using shock as a deterrent for certain behaviors. Um, so, but you know, a lot of kids they'll engage in different types of therapy with the therapist, like floor play. So it's
Hmm.
basically just a lot of
Sure.
interaction. That's a lot of teaching the alphabet and you know different
Hmm.
skills, brushing your teeth, and you know things that are really good and positive. But the issue is that a lot of those very good you know positive interventions are being interwoven into the ABA framework. So ABA in and of itself, people are saying, "Oh, ABA works really well," but really what they're saying is a lot of other therapies that have been added into ABA that is not
Okay.
ABA therapy. So, but again, this is a huge,
So,
huge controversial thing. So,
one in
so that was just
ABA, do
one thing.
they
Yeah.
actually take and customize that for the individual, or is it just one type of behavior and they make it fit for everyone?
Yeah,
Good.
right now it's very customizable. It's supposed to be very yeah, unique to each individual, but there is
Okay.
a strict framework. I know there's not as much
Hmm.
like schooling necessary in order to do ABA therapy. You have to go through a certification process, but you can do that with an associate's degree. Um, I'm not sure exactly what
Yeah.
the latest is on that, but all I know is you don't have to have a licensed therapy, you know, background
So
in order
these are
to do
usually the
that.
ones that are threes that you would find this appropriate therapy if it's selected.
Yeah, I don't even know that that's necessarily true because a lot of people, once a child is diagnosed with autism, a lot of the recommendations go straight to we recommend your child instant or
Mm,
immediately engage in ABA therapy. And the funny thing is for a lot of kids, this means 3 to 5 hours per day,
really?
3 to 5 days a week. So some children can get 30 to 35 hours of therapy per week
Mm,
of this ABA therapy. And I don't have to tell you
right.
how much money
I'm
is
sure.
involved with that. That's a
And
lot of
probably
money
if you're
per
in a
hour.
rural area, you would have to drive some distance if you can
Oh
even
yeah,
find it
if
in
you can even,
these areas.
yeah,
So
if you can find it.
is
Right.
so
Yeah.
ABA is used primarily on younger autism individuals.
Right. I've had some people come and ask for letters from me, hoping to get into ABA for their
Hmm.
20 to 30-year-old, you know, uh, individuals. But I don't know if that was successful. Again, I'm not sure what really
Okay.
happened there, but I think typically speaking, I think it's mainly just used
Right.
mostly for children. I think a lot of adults. I think I found that the best therapy for adults who, at least the ones that
Hmm.
I've had experience with, the best therapy has been humanistic therapy, person centered therapy, therapies that are based on I already like you for who you are. You're
Okay.
not broken. You're not disordered. What it is you live in a world that's very difficult to
Right.
navigate with sensory issues. You live in a world that's very duplicitous by nature. And since your mind doesn't always work that way, this can
Right.
create special problems for you in your life. So I try to go from more of a, you know, let's figure out how you work in this world rather than you're the
Right.
problem and you need to change and you need to be like everybody else.
And I think that's a big distinction between any therapy is you just meet the individual where they are and realize that how they process things, how they do things is quite different from other ones in doing that process. Our society has tended to be on medications. We like a pill to fix everything. So, is there any medications out there that is, first of all, that's used, but is there any uh, type of research being done and development of other drugs that may be effective in these with autism?
Yes. So far, they've
Really?
found absolutely nothing that's been effective across the board. Yeah, absolutely nothing. They've done some research on oxytocin.
I'm
So
not familiar
that
with that.
hormone, yeah, oxytocin is it's another word for that is the cuddle hormone or the love hormone. It's a hormone that's produced when You meet and engage with a friend and
Right.
identify some sort of belonging to them. It's a hormone that's
Uh-huh.
produced when you have an orgasm, or when it's necessary for a baby and a mother
Hmm.
to do nursing and during birth. So it plays a vital role. It's probably one of the most important hormones, I believe, when it comes to autism traits and features, because lower levels of this hormone are thought to be linked with different traits and features that are associated with autism, such as what the world sees as
Right.
not being attached to other people, or various things like that. So yeah, so what they've done is they've had a couple they've had a couple clinical trials, um, or not a couple. I'm sure they've had more than that, but they've found with some limited success, doses of oxytocin can help change a person's behavior and the way they think in a way that makes the what you would typically see as autistic traits decrease. However, there have been nothing beyond that. So
Okay.
not enough to say, hey, this works. Basically, it might show some promise in some regard, but there's nothing that says. Not only that, but I think the majority of the studies, from what I remember, are done on men only, because women have varying oxytocin levels throughout the month. So they wanted to, I guess, you know, eliminate a lot
Sure.
of confounding variables. So
Okay.
they said men only. So there are a lot of issues there. Now I will say this: one of the comorbidities, which is another word for another disorder that might be right there along with autism,
Hmm.
is ADHD. So attention deficit hyperactivity disorder. There are three types. There's attention only, there's hyperactive, and then there's combined, where you're both inattentive and hyperactive. And there are medications for
Okay.
that work rather well for a lot of people. I've heard a lot of good things.
Right.
Ritalin, Adderall, different stimulants. And so the funny thing is like, if you're diagnosed as being autistic, the chance of you also meeting criteria for ADHD is very high, somewhere around the
Sure.
70% level, somewhere around there. Now, they've also done research where they've just gone in and taken people who've been diagnosed with ADHD first and said, hey, let's also test you for autism. And they found around 50% of those people uh, are
Yeah.
get an autism diagnosis. So when you say, is there a medication for autism? Not necessarily, but there is for ADHD, and that's most
So
often
it's
a
a dual
co-occurring disorder that
diagnosis.
helps.
Yeah.
Correct.
Uh-huh.
Yeah. And then you can get
Yeah.
into anxiety and depression, and there's obviously a lot of great
Absolutely.
medication
What
options for
about
those as well.
genetics testing and trying to determine whether autism
Oh,
is
yeah.
genetic, has a genetic trait to it? Has there been any studies on that?
Yeah, I've read studies that go up to 78% is what's suggested to be the genetic factor there, a genetic disposition for it, passed down from parents. Oftentimes, when somebody comes in and they get an autism diagnosis, um, if we get into the idea of genetics, they start to go, you know what? Come to think of it, my dad
Hmm.
and I they were the same. And then they can go up the family tree, one side or both sides, and start identifying traits and features. And that doesn't mean
Right.
necessarily we're going to diagnose everybody up their family tree with autism, but they identify traits and features that have been persistent, that they remember in their family line, very consistent with autism. But
Right.
again, back then there wasn't autism. There was just like, hey, there's that guy who
Right.
just likes to be alone.
Exactly. And down in the South, we tend to say those people are just they're on their own path and beat to their drum and they're just out there. So
Okay,
that's very
yeah.
true on that one. So and when we talk about autism, uh, you and I talked a little bit. There is really no one talking about this issue in aging out there. How do we make it more of a subject because it's out there? How do we advocate and how do we get this to the forefront?
I believe there has to be money in it. I think if there's money in it,
Yeah.
then it's going to get attention. There's a lot of money in autism itself. We've got a lot of different organizations that claim to be autism advocates, and some really are. They're quite fantastic, and or the other organizations claim to like speak for autism, and they do in
Hmm.
my opinion, a pretty terrible job of advocating and speaking for autism. So yeah, I think if money were allocated for that, then there would be far more opportunities. Not only that, but I heard one writer say it's not fun to study
True.
older
Very
people,
true.
and maybe that's true. I don't know. From what I understand, like once your child turns 18 or 21, your services are pretty much
Right.
cut off as far as social services go regarding autism for the most part. And again, some would posit that, oh, maybe it's just not fun to not have kids hanging around doing fun
Well,
things, and I don't know, but that's one thing. So really, what we need is we need legal advocacy. We need
mhm,
like state sponsored bills to go up, or representatives, at the political level. Something needs to change there in order for this to get more attention. Maybe get a lot of
sure.
doctoral students start doing their dissertations on it. That would be a
Absolutely. I
fantastic
think what
opportunity as
really
well.
is out there on the aging population is we can't find anybody willing to go into the field, gerontology. We we have that is a
Oh
huge
wow,
issue.
I didn't know that was an issue.
We only, I think, I have one
Huh?
gerontologist in the entire Portland metro area, but it's not. It's and the other thing is the Medicare
Wow.
reimbursement rate seems to be lower in those categories. Which, if you have a huge student debt stuff, you're going to go the other options uh, than in gerontology. But when we talk about older individuals and autism, there seems to be a lack of understanding it in the facilities. So they'd rather treat the behaviors and symptoms than really look for the true diagnosis and then build upon that. Is that something that you think is a correct statement on that?
Right, I do believe that's correct, and I think the sad part is a lot of the symptomatology that they're looking at
Hmm.
is actually indicative of something else. So if somebody comes in and they've had
Right.
severe angry outbursts, uh, they might say, "Oh,
Right.
this person they need heavily medicated right away, and you're going to stay on this medication." Which again poses its own set of complications with side effects and things like that. But look a little deeper, and maybe we found an autistic individual who has such massive sensory problems, and maybe they're in a work environment that's not accommodating to their needs, and they're in a home environment that might not be the best place for them to be as well. So I always think of it as it just builds and builds and builds, and then once you get to a certain point, it's that straw that
Right.
breaks the camel's back, and it all unleashes, and then we have massive angry outbursts. And the worst part about that is a lot of them, again, may have
Right.
difficulty
Right.
communicating what's really going
Right.
on. So you'll get a lot of, I don't know. Or even
Right.
worse, they won't go in at all. They might get taken in. And the saddest part is when you get law
Right.
enforcement involved who are not trained with autistic individuals,
Right.
and they don't know what they're looking at. They might be looking at a drug addict who's, on some sort of wild drug that's making them
Right.
erratic, and it's a surprise what they're going to do next, and there could be some
Right.
major consequences to everybody in those situations. So yeah, just treating the symptom is not going to work. It never will work. You have to identify where the core is at, and usually, again, that's the benefit of the testing for autism, is saying, oh, this, I think we've found a major reason for a lot of the ways you are. So
Exactly.
now start learning
Sensory
about it.
overload tends to happen with our clients. It's really prevalent during the holiday season because that's when all the people come in to sing, all the activities, and all of that good stuff. And I've always said, that some people just this isn't their thing, and we just need to kind of do it a more quiet type of thing and not really pressure them into participating. And when they say to one of our clients, well, this person's not participating in activities, I said, well, they didn't participate when they were younger. What makes you think they're going to participate now? You know, they haven't changed. So you just think automatically putting them in a facility setting, they're going to all become involved and engaged in all these stuff. That's just not going to happen. So it's always interesting to me around the holiday season. I can tell you we have more behavioral issues uh, during that time, and we have a lot more people check out and pass away during that time. I think they just said, "I've had too much of this. I'm just going to call it quits," and we see that happen a lot. Well, I am too, but it's just, it tends to happen during that time of year. And I think it's the overload and everything coming into it that just drives these behaviors. Because if you have to sit there and listen to Christmas music all the time, you're probably going, I don't like it and I don't want, why am I here? And so you're going to behave. So they'll take you back to where you can have a more quiet setting.
I think that's an excellent point being made, that we have to ask ourselves who is it that's
Yeah,
organizing these things, and it's typically going to be a neurotypical person who really loves Christmas, and they've got all the great ideas, and they've
right.
just been hired as a coordinator for the activities, and so yeah, to most people it looks great on the outside, but yeah, it's probably a special kind of hell going on inside people's minds.
Yeah.
Specifically, think about the flashing lights. So something about me, a little self disclosure, is
Yeah.
I am completely surrounded by autism all the time, every day, all day. I've got family members with it. I myself have been diagnosed as an adult with it. Um, and it's one of those things that I understand so deeply and so uh, intimately, that I totally get it. So, for instance, a trip to Home Depot for one person might be just fine. Might be a little aggravating. You
Hmm.
can't find the price tag of something, or people come up and ask you questions. But to a person who's autistic on the spectrum, it's a whole. It is literal hell being in there. You have the worst noises on earth of clanging pipes and beeping forklifts, and then you got people approaching you, and some people don't smell great. That's a thing. And then you've got overhead lights, and like luckily in the Home Depot or something like that, it's a lot better. But you go into a lot of places, and like going to a movie theater, terrible for autism in a lot of regard, especially when you get trailers that are coming up at first that have a lot of flashing blinking lights, and you've got, if you don't like the smell of strong popcorn, then that's an issue. If people are sitting in too close, that's an issue. You can hear the person in the very back corner whispering to the other person, and now that's all you're thinking about.
Sure.
These are things that I've heard a lot of people talk about, and it's one of the reasons I'm so passionate about this, is because I experience
Right.
a lot of these things, but maybe not to that level of what I'm describing. But I get it. I totally get it. Sometimes it's better, and sometimes it's worse. So it just depends on who you are, and what you have going on in life. Because again, there's something I call transient traits and features for autism, which means you might have it today, and then tomorrow or next week it might
Right.
not be that bad, or it might not be existent at all. So it just kind of depends on who you are and where you're at. So I totally get what you're saying about the holiday season, and if you're living in a world that doesn't accommodate you and doesn't understand, and they keep pushing you to participate in things you don't want to be in,
Absolutely.
I could, depression, checking out, medication issues. I mean, we can start piling on
Absolutely.
all kinds of different
Yeah,
reasons.
exactly. Well, Anson, I want to thank you so much for our discussion on autism. I certainly learned a lot about it, but again, I've always appreciated you for your passion that you have for autism and working in that community. And
Well, I appreciate that. I appreciate your work with the
right.
individuals who are in need help.
And I will plug, you have videos out on subjects. You have podcast. I just read an article in Spectrum magazine that you did, and doing that.
Oh
So
yeah.
if anyone will also put up how to get some of your materials and do that on our website and on our Facebook and LinkedIn page. So if anybody's interested, we'll have that information up and available.
I appreciate that. A lot of the stuff on those videos, by the way, are things that I wish I
Right.
had time to tell people after diagnosis. So it's really good to point somebody who may be thinking along those lines and be like, "Hey, go look at these," because this is just. I only have an hour with somebody after I give them a feedback session to give them all the information. I can't do it, so I began making videos to be able to disseminate some of this information to them.
So, Anson, thank you so much, and we'll catch you on the flip side.
All right. Thank you. All right. Bye.